Let's get this webinar on the road. Good morning, everybody. My name is Darius Young. I am the Health Equity Policy Manager for BARHII, and we thank you for attending our reentry webinar in the era of COVID-19. Before we get started, we're going to do a little logistical stuff, so just bear with us. Next slide. Siobhan?
So Darius, you just need to click to the left or right on this to
Yeah.
advance your own slides.
Okay.
There you
So,
go. Perfect.
Just some logistical stuff. We know that on the bottom of your screen here, we have is everybody with me? Just bear with me here. On the bottom of your screens, we have all of our chat features. You could hands up, clap. Also, we'd ask all of you to mute your screens, your microphones during this time, and would also ask that the participants have theirs muted until they actually are up to speak. Also, this webinar will be recorded, and so if anyone objects to that, just let us know. We will still record it, but we'll make sure that anything that you say that you don't want to have heard, we will be cognizant to delete that. So, who is BARHII? BARHII we are a collection of health agencies, 11 health equity agencies here in the Bay Area. And what we do is that we provide a variety of services for public health departments, allied agencies, and community-based organizations adopt and implement policies that can improve health equity. That includes us actually writing white papers, like our piece on the health rationale for emergency eviction moratoria, which was used in agency staff reports and local campaigns, which help to contribute to securing 100% of Bay Area counties adopting emergency protections for COVID-19. And what is our mission? Our mission at BARHII is to transform public health practice for the purpose of eliminating health inequities using a broad spectrum of approaches that create healthy communities. And what do we do with our white papers? Essentially, what we are doing with those are that we use them to conduct trainings, and we also provide technical assistance to those that request it. So what are some of the systemic problems and solutions that we are trying to look at and eliminate? So our focus is on making equity tangible and to move big ideas into action in participation with you. BARHII is there from policy to power building to implementation, and to also ensure equitable Bay Area for all. One example that I'd like to share with you is something that we did in Vallejo with the Vallejo Housing Collective. We worked collaboratively with a coalition of community leaders, public health departments, nonprofits to co-invest in a comprehensive housing justice strategy to stabilize Vallejo. We hosted trainings alongside Urban Habitat on housing affordability and health on implementing what is our 3 Ps of housing affordability in Vallejo. BARHII also secured several years of funding that allowed the all-volunteer Vallejo Housing Justice Coalition to hire full-time community organizers. So what is reentry in the era of COVID-19? Yes, sir. So why is this webinar important? So we know that in 2020 will be ever, cemented in our minds for COVID-19. The pandemic has been devastating for individuals inside the California jails and prisons, disproportionately impacting people of color. After major outbreaks of COVID-19 in the prisons and jails, California began a process of early release for some incarcerated individuals. Those early releases exposed substantial shortcomings in California's policies and systems that impact people experience reentry, including housing, healthcare, and other support services. The pandemic has revealed substantial systemic barriers to the health and well-being of those leaving incarceration, putting the health and well-being of tens of thousands of formerly incarcerated people and also their loved ones and communities at risk. One thing that that I really believe is important to highlight is that for us to keep in mind that because of the racial disparities in incarceration, a significant number of those released will be men and women of color who will be returning to communities that have been disproportionately impacted by COVID-19 and are reeling from the severe economic contraction caused by the pandemic. At the same time, 2020 will also be remembered as the year our country saw months of protests throughout the US caused by the murder of George Floyd by Minneapolis police officers. Those protests have drawn national attention to community demands to reform systems of policing and incarceration and direct public investment from systems of punishment toward unmet needs. This webinar is an exciting opportunity for us in this moment when we find ourselves to examine the challenges faced by people experiencing reentry and by reentry service providers. So, what is the work that BARHII has done in reentry in terms of fair chance and with our partner organization, Rise Together, who we merge.
Anymore.
What's that? Can I ask you to mute? So, with our fair chance work at BARHII, this webinar is part of a body of work that BARHII and Rise Together focus on providing fair chance opportunities for everyone with a carceral history. Ending discrimination against people with a carceral history has been important to BARHII for many years. For example, we have also successfully supported bail reform, and we've also supported efforts to ban the box both in housing and employment. So the question is, for me, why does this matter for me personally? Well, having spent 20 years in the criminal justice system, I experienced the barriers to housing and employment, as well as the stigma of being branded a felon. That is why this work matters so much to me, because I know firsthand that when persons with criminal convictions are provided those supports needed to get back on the right track, he or she can contribute to the betterment of society. So let's look at what our objectives are for today. Our objectives for today will be to understand the challenges faced by those experiencing reentry in the Bay Area and in the era of COVID-19, especially for communities that have experienced substantial inequities, that being Black, Latinx, the LGBT community, and others. And we'll also are going to look at identifying solutions to those challenges that could be adopted locally and statewide, especially solutions that are unique to the COVID-19 moment, that addresses new challenges or harness new political funding opportunities. Below this slide has just what the agenda will look like going forward. So now that we have gone through some of those things, I would like to give you a brief introduction of some of our speakers, all of our speakers. Our first speaker will be Kim Carter. If she can just give a thumbs up on her screen. Kim Carter is the founder and ambassador of Time for Change Foundation. Today, she is a powerful leader for transforming the lives of those impacted by poverty, marginalization, and recidivism. In 2002, she started Time for Change Foundation for previously incarcerated homeless women and quickly created additional housing for those women and their children. Kim is the author of Invisible Bars to Women's Health and Well-Being During and After Incarceration, a scientific, quantitative, qualitative health report which provides a roadmap for addressing issues that both lead and to eliminate incarceration. In 2017, Kim was certified as Gallup's Strengths Coach and is currently the president and CEO of Center for Housing Advancement and Motivational Projects. Kim has notable achievements, too numerous to name, but just to name a few. She was Rialto Mayor 2018 Jewel Award winner. She was also Ebony Power 100 Top Influential African Americans, and she was also has received the NAACP Award. Give a clap on your screen for Miss Kim Carter. Next is Dante Blue. Dante is the acting director of Contra Costa County's Office of Reentry. Dante is a graduate of both UC Berkeley and UCLA School of Law. Dante is his work in Contra Costa and the system of rehabilitation is really thorough, and it moves partners to research informed approaches to improving the outcomes and impacts of the county's local justice system. Let's give a hand clap or a thumbs up to Mr. Dante Blue on your screen. Our next panelist following Dante will be Chloe Noonan from the organization Root and Rebound, where Chloe is the Associate Director of Legal Legal Education. Chloe, where she has worked at Root and Rebound to improve access to information and educational resources for people impacted by the criminal justice system and those who support them. Chloe has also experience in eviction defense and affordable housing preservation work with renters, working to establish more permanent housing for people experiencing homelessness and building ways for law students to engage in environmental justice work. She graduated from Boston University School of Law in 2016. Let's give a great thumbs up or a hand clap for Chloe. Our next panelist would be Donald Judge Smiley, and a lot to say about this man. He was appointed to the bench by Governor Edmund Brown, also known as Jerry Brown, and he was appointed to the Alameda County Superior Court in 2012. He now serves as the court assistant presiding judge and as a supervising judge of the collaborative courts. Previously, Judge Smiley held the position of presiding judge of the juvenile courts. Judge Smiley began his legal career as a deputy public defender. During his practice, he worked in various roles that include trial lawyer, appellate unit lawyer, and branch supervisor. Prior to his judicial appointment, he also worked on the bench as a court commissioner, presiding over family law and small business claims and traffic. Over the years, Judge Smiley developed an interest in legal history. Following that passion, he has been archiving the people, stories, and achievements of African-American jurists in California. With the help of other history enthusiasts, he has collected documents, interviews, and information about pioneering jurists throughout California. And he also lectures on the topic several times a year. Judge Smiley resides in Oakland with his family, and he's also a 1989 UC Berkeley graduate. Let's give a thumbs up and a hand clap for Judge Smyers. And our last but not least would be Donald Frazier, who is the Executive Director for Building Opportunities for Self-Sufficiency, also known as BOSS. For more than 20 years, Donald Frazier has demonstrated leadership in high-level roles in the nonprofit management sector, specializing in fund and program development contracts. He has a proven record of success in forging collaborative and collegial working experiences in the development of innovative projects in healthcare, reentry, and workforce development. Born in the Cabrini Green housing projects in Chicago, his formative years were immersed in psychoeducational, empirical experiences and observations of concentrated and persistent poverty, inequitable economic conditions, racial, residential segregation, poor and inequitable health outcomes. Over the years, he came to realize those experiences informed his life and his work as he acquired significant insight in nonprofit, innovative social justice and public policy that have provided a foundation for further developed solutions to advance innovative and effective models to change the narrative and trajectory of individuals, families, and communities impacted by police violence and racial inequities. Let's give a great big round of applause, thumbs up for Donald Frazier and for all our panelists. Thank you. We will now start with our first panelist up. That would be Ms. Kim Carter.
Good morning, how you doing?
Doing well, thank you.
Okay, I need, you just stop sharing your screen to let me share mine.
Right.
Okay.
Gotcha.
So I want to take this opportunity to just welcome everybody here today to the webinar. I want to thank BARHII for considering me to be a part of this panel. I just want to say that I appreciate that. I think there's public health that's in the mix today. So I'm going to do my presentation from a perspective of social determinants of health. I just ran and got my phone charger, so much for that.
And Kim, I think we need to.
The purpose of my presentation right here.
Kim, I think we need to switch over to your PowerPoint. We're seeing your web browser right now.
Did she make me a host? How about
Perfect.
now? Okay. So understand the root causes. So one of the things that I think is important to realize when you're working with systems is that you need to understand the root, the epidemiology. So I was fortunate to be able to do the pathology of incarceration and understand causes and conditions, and actually have to build programs and services that address those systemic issues, the racism and the impact on families. And so today my work basically is efforts to dismantle those systems while also building capacity for our community. So Time for Change Foundation was started 2002. And what we do, we provide housing, various housing, permanent supportive housing, affordable housing, and emergency shelters. We provide supportive services. We are licensed drug and alcohol outpatient. We are an advocacy group where we believe in teaching women how to use their own voice and actually go from breaking laws to making laws. We actually do community development where we actually build our own affordable housing. And we do tons of training on evidence-based programs like strength-based case management, motivational interviewing, and other assessment tools to help people to really get to the root causes of conditions. So this right here is another illustration of one of our housing developments. As you see, this is the low-income housing, because as you guys know that the housing needs for our community has not kept up with the pace, and there's nobody coming to build the housing that we need. We must do it for ourselves. So Time for Change Foundation start building the old affordable housing. So My motto that I created, it goes with three factors: the environment, the agent, and the host. So I was able to present this motto at the American Public Health Association, where I met three surgeon generals in one day. Because what we find out that there's things going on in the environment that sets up the ideal situation where people are prone to incarcerations. We can look at the individual, which we call the host, and what's going on there. You know, lack of family support, being disenfranchised, low socioeconomic status, susceptible to drugs and alcohol addiction. And then we look at that agent, that terrible thing, that agent, where you start with the police and it goes all the way through the court system to where you have Black and brown people being unanimously convicted and overcharged, over-policed, underprotected. And as you see, the result of that has been the prison industrial complex and mass incarceration. So these are the three different components, and it's broke down, just like I said, a little bit of the education going on in the environment that's lacking, the poor health. And basically there's been a divestment in our communities, right? We talk about this agent, the legal system, the prisons, the get tough on crime policies that have taken place over the years. We see the result of what's happened. So where has been society's focus? Has it been on supporting families? Has it been on creating jobs? What about housing opportunities? Well, let's follow the money. And what we see is over a 20-year period, billions and billions of dollars was put into building these facilities that basically takes Black and brown bodies, puts them in these facilities, put them to work, producing the prison industrial complex. And what happens in our community was left without housing resources, healthcare, other things of that nature. And when it was all said and done, after all these prisons was built, there was just one thing that was built for education, and that was the UC Merced. So it wasn't a lack of California having money, because the money was there to build those prisons. So when they say we don't got money for childcare, we don't got money for early education, you had a whole lot of money came to build these prisons, and it shows right there. So this leaves us with this unhealthy environment where our physical environment is poor. We don't have great safe spaces in parks, access to care, poisons in the air. We're in the midst of a pandemic with an epidemic, and racism is a public health crisis. We don't have quality, affordable housing, affordable for people who are called essential workers, and everybody that go to school is not going to graduate. So the education system is not where it should be. So what happens? It leaves us to be on the front lines fighting medical eligibility for all, right? Now, mind you, those was billion-dollar prisons that was built. What if we had $1 billion put into investing into our kids? What if we had $1 billion put into ensuring that we had housing or medical insurance, or that our education system was able to ensure that every child in California was able to access higher education and to thrive in our community? So there's an elephant in the room. And so that elephant in the room is that basically public health has been largely ignored, right? Because public health mandate is that you have to ensure that there are conditions in which we can live healthy. Well, guess what? We have not been living healthy in these conditions. And as a result of that, we had all this money going into incarcerating people and no money coming to our communities. And public health is best positioned to understand social determinants of health and to be able to enact similar remedies. So when we look at communities and say, oh, it's heavily invested with crime. Well, crime is not the cause of community dying. It's the sound of community dying. So when you don't hear investments being in for job training programs and for business development, entrepreneurship, and street pavements and parks and libraries. When money's not going into that, then you're going to hear the sounds of crime. But it's not the cause. It's not the root. And remember, ladies and gentlemen, we're talking about getting to the root today. Right? And then public health is also poised to help, translate evidence-based evaluations and research into policy and practice. So, when we go to these institutions of higher learning and we learn about research and evaluation and, using the big N and the little n and, community-based participatory research. I mean, even I, Kim Carter, do not have my PhD, but I do have my PhD. So I was able to track the epidemiology of incarceration using a social ecological framework and present this information that I'm so passionate about in a scientific form where I can tell you exactly what needs to happen. So I'm saying to all the audience out there, it's time for us good people to get into some good trouble. So as Darius mentioned, I am the author of Invisible Bars, Barriers to Women's Health and Well-Being During and After Incarceration. And again, this is like 2005, but because I'm formerly incarcerated, because I've been hungry, because I've been on drugs, and I've been, resurrected from that, then, it was easy for society to discount, do I even know what I'm talking about? Because, how could I when I've been succumbing to those conditions? But see, I was able to get healthy. And I was able to get healthy. I was able to get into my right mind. And my mind still had ability to think and problem solve and create the very solutions that have been missing. So I started wondering, well, if you guys already knew this was going on and you already could see all the data, like if you're not reading by the 3rd grade, start building prisons, you could already see all that in advance using the sciences, why didn't you use the same education information to prevent things, to create things that would help us? And I realized it is that we keep us safe and we are the ones that we're looking for and we are the change we want to see. So fast forward 2020, we're looking at positive futures. I have a couple of evidence-based programs going on right now. And one of the things about asset development and wealth creation is that because there's been such a major disparity in accessing wealth and creating what we need, we really focus programs on helping women to go from poverty to prosperity, and not just in the word, but in actual social economic mobility ladders, where they're able to access not only living wage jobs, but to be able to create entrepreneurship, to be able to access wealth, to learn about savings, to understand what it means to actually be able to take care of you and your family. And so that's one of the things that I find that's near and dear to my heart, is to be able to help women to take that climb, because I was one who couldn't get a government job. Now I can manage multiple government million-dollar programs, right? I was one that you didn't think could get a house, but I went from being homeless to building buildings. So ain't nothing that we can't do. Went from breaking laws to making laws. So I'm charging everybody out there to let's get in some good trouble.
All right. We thank you, Kim. That was a very telling presentation. Next up, we have Mr. Dante Blue. Dante, the show is yours.
All right, are you able to see it?
Yes.
All right, good. Well, just want to first start off by saying thanks to BARHII for the invite to share with you today and to participate in this, and also to all my co-presenters for the work that they've done. Hard act to follow going after Kim, but I will do my best here. And then I also want to thank some of my just local reentry partners who've really been thought partners and helped me think through some of the things that I'm going to share today. So my name is Dante Blue. I'm the current acting director of the Office of Reentry and Justice, which actually is a division of our county's probation department. So, in this presentation, we'll be brief. We'll start off as we kind of roll through the county here, Contra Costa County. We'll start off with trying to get some context around reentry. And then as we move east in the county, we'll think about exactly some of the challenges we've seen in COVID-19 and how we might think about the reentry's perspective on those challenges. And then as we kind of move south down our central corridor there, we'll end with final thoughts. So, what I want to start off by saying is that the Office of Reentry and Justice is a government agency. Unlike any of my co-presenters other than the court, I'm the only government agency here. But furthermore, while a lot of my co-presenters do have the privilege of working with individual clients, my clients are actually organizations. So it's our county partners, our community-based partners, and really thinking about, how can we address reentry from the system level. And so a lot of what I'm going to present today comes from that angle, thinking about the intersection of the reentry system with our other systems of care. And specifically what I would say is that this doesn't mean that I don't get a chance to work with or to think about how the reentry population is impacted by my work, but it does mean that working with my partners, a lot of my job is trying to coordinate our reentry system and see how we can make that more successful. And so in doing that, as I think about reentry, for me, the first thing is that I think about it in terms of, objective based. By community reintegration, I'm very specific in this idea that we're thinking of how can we get all members of our communities to not only share in the burdens, but also the benefits of being in the community. This is, a bilateral investment in well-being. A community is invested in all of its members' well-being, and all the members are invested in the community's well-being. And so it is that bilateral relationship that really matters. I also think of my work in reentry as not just that moment as you reenter, but really how is this a countermeasure to what I call the weapons of mass incarceration? Really thinking about how incarceration, mass incarceration, different things happen at different stages of the legal process that lead to that and lead to the effects that we all are well aware of around mass incarceration. How can the work that I do undermine that at all of these different stages? Now, thinking about COVID-19 specifically in reentry and working with my partners, I've asked, so what does that look like on the ground? And, the first thing they say is that wherever we were already challenged as a system, it becomes more glaring. Things seem to be more enhanced. So as we're working with individuals, their needs are more intense. So this is really an issue of degree rather than kind. It's not necessarily that we're seeing a bunch of new things, but what might have been a problem before is really a problem now. So as we kind of think about this, some of the public health challenges that we've seen around health orders, I bring up masking, testing, quarantines, because there've been some challenges, and some of those challenges are, hey, so it's really largely been around how do we enforce these health orders, right? Are we going to use fines? Is that the right approach? Should we identify people who are under supervision, and if they're not quarantining or refuse to test, should we reinforce that with sanctions of their supervision, right? These are real conversations that have occurred. When we're thinking about sheltering, providing services while people are sheltering in place. What does that look like? Are we really considering all the implications of this kind of Zoom everything culture that we moved to? And then as has been kind of touched multiple times already today, and I'm sure we'll do it many more, is this idea of racial disparities. So as COVID has occurred, how have those racial disparities played out? And when we think about, a reentry perspective, I offer a few thoughts here. First is this idea of money, right? Money always, and probably complicates is too soft of a word. I think it really corrodes justice, at the least. Money is something that seems neutral, but it's not when you put it into this framework. Also, this idea that in reentry, community is really centered in the work, which is, again, we're thinking about how we can build community around an individual, right? What are the supportive networks that they need? But also, how can we support them to be a part of that community that we're helping shape around them, that system of support. And really, as we're thinking about, we're developing our services and kind of, shaping them around sheltering, are we thinking about what that means in terms of community? Are we sensitive to the fact that we want to build trust, we want to build community? Are there opportunities where we can do that, and are we taking advantage of that? The last thing is that, and I think this is a big one, is that people are the star of their own story, right? First and foremost, we're not saving people, right? We're supporting them, right? There's no white knights here, coming in and taking the glory and being the savior. We're really about empowering people to be part of their own solution, right? And so when we're thinking about from the government's perspective, how are we pushing towards that end, right? How are we making space for people to actually be part of their own solution? These are the things that give that reentry perspective for reentry specifically, are we thinking about that population specifically? And so, because we don't have much time, I'm going to push forward through to some final thoughts here. First, I say reentry in the shadows. And I say reentry in the shadows really because if you're not asking questions, if you're not gathering data about this population, you might say, oh, well, we know that we have, I have a work program, and I know some other people have been to jail or to prison. But are you collecting information? Are you learning more about how that population moves through your programs? Are you actually, as you make decisions, having them at the table to help make some of those decisions? When you're thinking about investments that need to be made, we just heard a great deal about disinvestments, but in thinking about housing, are we interconnecting systems? As people leave jail, are we ensuring that no one goes from jail to the streets? Behavioral health, COVID-19, what does that mean in terms of behavioral health? Substance use disorder, people who might be suffering from a mental illness. Technology, if we're going to go Zoom everything, are we making investments to ensure that nobody gets left behind, that everybody's connected? Are we making those investments to make our efforts successful? And the last big one here is, truly are we understanding the cost of incarceration? Not only their effects on their fiscal impacts, but also their effects on public health. Here we are in COVID, and when we talk about the cost of incarceration, what we know is that, yes, they're how it impacts the public purse, as was just stated, money that goes to one place can't go to another. Our effects on public health, if we're leaning on a system of incarceration, is it actually putting us in a situation of actually being more at risk of having lower community health? And if that is, we need to really rethink that and consider that. So again, these are the types of questions that have come up and the thoughts that have come up as we think about the way in which we can frame this work. So with that, I will pass it back to Darius to move forward in the presentations.
And everybody give a hand clap for Dante. Great presentation. And moving forward on this agenda, we will hear next from Chloe Noonan from Root and Rebound.
Great, thank you so much, Darius. Hello, everyone. I'm Chloe. I'm the Associate Director of Legal Education at Root and Rebound. I'm very thankful to be a part of this conversation today and to talk a little bit about what we're seeing in terms of reentry needs during COVID. I'm also going to talk about a couple recent policy changes that folks may want to be aware of, and raise just a couple thoughts on strategies for continuing to engage on these issues. So I will take a moment and share my screen. This will take just a second. There we go. All right. So again, thank you very much to BARHII for organizing this panel and making the opportunity for this conversation. I'm really excited to be with you all today. To introduce our work, I'd like to start by sharing Root and Rebound's mission statement and key programs. So the goal of our services and advocacy is to restore power and resources to the communities most harmed by mass incarceration through legal advocacy, public education, policy reform, and litigation, a model rooted in the needs and expertise of people who are directly impacted. Our key programs are direct legal services, for example, through our statewide reentry legal hotline, our community-based legal clinics, as well as our public education work, and our system reform efforts, which work to use policy reform and litigation to change harmful laws. Our headquarters are in Oakland, and we have satellite offices in Fresno, San Bernardino, and Los Angeles, as well as in Greenville, South Carolina. And in California, our legal services and advocacy take place statewide. We work to be client-centered and use an empowerment model of advocacy. So we work to be a value add where it makes sense and empower clients to self-advocate where that makes sense. We don't have a cookie cutter approach for many legal issues and tailor our support to consider individual client factors such as their own knowledge and comfort, advocating in the area they're working in, case factors such as how legally or procedurally complicated the issue is, as well as how related to reentry the legal issue is that we're trying to address. We've heard from a couple of our panelists already about the really severe impacts of mass incarceration on communities. I just wanted to add a couple statistics to that conversation. So today there are 48,000 collateral consequences of having a record across the United States, and that includes federal, state, and local laws where it is legal to discriminate against people who've been impacted. Studies have found that 1 in 3 Americans now has some kind of record. And since 1978, California's prison population has grown over 600%. Lastly, as folks on the line are aware, the proliferation of mass incarceration has not impacted all groups of people equally, and the most severe harms of criminal legal system involvement disproportionately fall upon and impact people of color and people living in poverty. There are a lot of different kind of areas of law that fall within the concept of reentry law. So this slide is just to illustrate the 11 reentry legal topics that our organization works in to try to support folks. So we see employment comes into that conversation, housing, education, something as simple as getting ID has a lot of barriers in it. Family law as well, and other topics. So now I'm going to talk briefly about what we're hearing from clients during this time and what resources we've developed to try to support people who are struggling right now. And I will note that there definitely has not been as much financial and investment and resource investment in coordination in reentry in general, and especially during COVID, which has exacerbated a lot of the issues I'm going to talk about. So while many of the reentry legal areas that people call our hotline about have been the same during the pandemic, we're also seeing how current circumstances are exacerbating existing barriers and challenges in accessing resources. So, for example, we've been seeing how agency closures are impacting people's ability to access vital services, and court closures have been leading to delays in successfully making essential filings. Some callers are telling us they've had trouble accessing COVID-19 federal and state resources. And remember, this is at a time where a lot of people are losing their jobs and are being laid off. So those resources are very, very essential right now. And yet people are having trouble accessing them. On the employment side, we're concerned that hiring during COVID is going to lead to a wave of fair chance violations by employers all at the same time. And I'm going to talk a little bit about the Fair Chance Act a couple slides from now, which will talk about some of the legal protections we have in California for folks who are seeking work who have conviction histories. That said, even though that law passed in 2018, there's still not a ton of awareness and education around what the law requires, and a lot of employers are still violating those laws and discriminating against people with records when the law says that they shouldn't be doing that. So that's a huge issue on the employment side. And then for housing, we're seeing that some landlords either don't know about the interim eviction protections or are just choosing not to follow them and are violating the moratoriums and trying to push renters out of their homes. And, with the pandemic, the public health concerns that are wrapped up in that, having stable, secure, affordable housing is really, really essential right now. And yet it's something that people are still struggling to access, are arguably more than ever right now. So Root and Rebound's COVID-19 response, I just want to kind of give a plug for a couple of resources that are out there that the folks on the line may want to access and take advantage of. To help people connect with information during this time, we've developed a COVID-19 page on our website, which compiles resources on a range of different reentry barriers. We've also started doing virtual panels to connect with the communities we serve in partnership with community activists and experts. And in addition to that, we've been working statewide to compile a comprehensive list of the reentry service providers who are still operating, providing services, and accepting clients during COVID-19. And I'll have my email address on the last slide. If you'd like to reach out to us, we're happy to share that resource. So essentially, when the pandemic started, one of the things that we were really struggling with was even figuring out which organizations and community-based resources were still open, were still available, what their hours were, how the clients calling our hotline could get in direct contact with those community resources. And so that's, how we arrived at the work to put a provider list together statewide. And we've been soliciting input on this provider list through surveys and asking reentry service providers to put their information in, let us know how they're operating right now so that we can then share that information out to the communities that we're working with. Now I'm just going to mention a couple recent state policy changes that illustrate where efforts to reduce collateral consequences and the harms of incarceration have advanced somewhat, but also to show how much more advocacy is still needed in this area, as a lot of folks my colleagues on the panel have already mentioned. So while Root and Rebound has been around for over 7 years now, it's really only been in the past 5 years or so that we've seen the state legislature start to build up steam in creating protections against discrimination for people who've been directly impacted by the criminal legal system. As I mentioned, one law to highlight is the Fair Chance Act in the employment context, AB 1008, which went into effect January 1st, 2018. While some employers are exempt from this law, it does apply to most employers across the state with 5 or more employees. And essentially, it's designed to help protect people with records from discrimination in the hiring process by requiring that employers hold off on running a background check until they've made a conditional offer of employment. Another law I want to mention is AB 2138, the Fair Chance for Occupational Licensing Act. Occupational licensing can be a huge barrier to employment in our state for folks. Hundreds of professions in California require a professional license, and different types of licenses are each overseen, approved, or denied by separate licensing boards. So AB 2138 applies to licenses that are regulated by the Department of Consumer Affairs. DCA is the largest oversight department, regulates 39 different boards, and essentially prohibits DCA from denying licenses on the basis of most, certainly not all, but many and most criminal convictions that are 7 years old or older. That said, there are exceptions and convictions that are excluded from AB 2138, and we're working with a broad coalition to educate the public on who qualifies and what to do when the law isn't followed. Lastly, I want to mention a new law that can be referred to as the Ban the Box in Higher Education Law, or Fair Chance to Higher Education Law, which passed as part of the budget trailer bill, SB 118, along with a lot of other new laws that were kind of included in this same bill. And essentially, this law helps protect students from discrimination in the admissions process as they apply to master's degrees and other programs. I'm just going to make a couple other points and then I will wrap up because I know we're short on time. I mentioned these policies in order to illustrate that finally there is some movement forward in increasing protections against the collateral consequences of arrest and conviction histories in California. And at the same time, these laws have real limitations. They have carve-outs and exceptions where people, some folks across the state who have been impacted by incarceration are not going to be able to benefit from them. And we need much broader policy reform to really change and undo the harms that mass incarceration has brought to communities in the Bay Area and across the state. As we've seen, and as Kim Carter talked about earlier, the public health impacts of the existing system are really, really broad-reaching, really severe and harmful. And public health departments can have a strong role in supporting and advocating for more opportunities and inclusion for systems impacted people. We hope to see more engagement across agencies on these issues in the months and years to come. And we do hope that you will reach out to us to connect and partner and see how we can work together to bring people more support, more protections, and more opportunities in the months and years ahead. If you encounter someone who needs direct legal support on a reentry issue, this is the phone number for our reentry legal hotline. If you want to reach out to me directly for educational tools, resources, and talk about opportunities to partnership, my email address is right here. I do want to say thank you again to BARHII for bringing us together today, and I'm really excited and hopeful that we can continue the conversation on working together to just, undo the harms that have been done through mass incarceration and create more support for folks. So thank you very much.
Thank you very much, Chloe. Just give her a clap and move on to our next panelist, which will be Judge Charles Smiley of the Alameda County Superior Court Collaborative Courts. Thank you very much.
Thank you. And greetings, everybody. It's always wonderful to get together and be reminded that we get to work in a community that's rich in resources, commitment, brain power, and good ideas. Thank you, BARHII, for inviting me and inviting Alameda County Superior Court to be a part of this conversation. I was asked just to say a few words about Alameda County's reentry court. The reentry court is a part of our collaborative court system. We have several collaborative courts. We also have treatment courts. All the courts in some way, shape, or form focus on mental health and substance use issues. But as it relates to reentry court, the focus is on the formerly incarcerated because all the participants, we don't call them defendants, all the participants in our program have come to us on PRCS or on parole. And we are a remedial court, meaning the folks who get out on either Alameda County supervision or who are on parole, they do not automatically come to us. We're remedial in the sense that if someone commits a violation, and that is a first signal that this person is struggling, having some difficulty after release from prison, one of the choices available to a parole agent or to a probation officer would be to refer that person to our court. Consequently, many of the people we work with are very high risk and high needs folks and who are in a period of crisis, struggling. So our collaborative reentry court, it's an interdisciplinary exercise. We consider ourselves a treatment team and we place our participant in the middle. We make decisions together with the input of the participant. At the table, we have a dedicated prosecutor who's been with the program for a very long time. We have a dedicated public defender who's with us, and people who have individual attorneys who are not public defenders also get to participate. We also have a host of clinicians. Alameda County Superior Court has its own office of collaborative courts. This means that we have our own specialists on hand who act as case managers and who have different expertise. Some are recovery specialists, others work in the field of mental health. You're looking at the mission statement of the Alameda County Superior Court. We all work together with dedicated probation officers and a dedicated parole officer to achieve goals of achieving stability. I mean, at the root of our work is to prevent recidivism, keep the public safe, but we're also trying to improve lives and be transformative in that work. So as you know already, folks who return to us from prison and end up on PRCS probation, or who come to us on parole, they're with us for just a short period of time. For PRCS, for example, the limit is 3 years that you can be on PRCS probation. So we'll get someone for just a portion of that time. People come to us on a violation, and our first role is to make sure that we conduct an assessment of some sort. So we use an objective tool to figure out what a person's needs are at that particular moment. And from there, we can figure out what the treatment plan will look like. I mentioned earlier that all of our decisions are by team, and so We have to follow by law evidence-based practices when we're serving the reentry population. That carries on to the reentry court as well. Everything we do is evidence-based, even the way we conduct our court proceedings themselves. So it's well orchestrated. Everything has a purpose and a goal. We will recognize any sort of achievement or milestone with all of our people, but we will also select folks to come share with us and give a tip of the day, for example, at the very beginning of our proceedings, so that folks can benefit either from someone's struggles and what they're doing to overcome them, or folks who are really model participants in our program because they've achieved successes that we want to model for other folks. I haven't gone to law school. I can't resist the opportunity to speak too, so I always begin each session with some words from me as well, just to make sure expectations are clear and to let people know. The reentry court is not a go to jail court because it's a treatment court, and that's what we're looking for. A lot of the work that we do is just talk, buy-in, encouragement. We have some tools available to us. Many of those tools have been frustrated by the pandemic. But we've heard today about many of the challenges, and we're not immune from any of that. Any treatment program is going to be affected by a pandemic because the shelter-in-place rules limit the availability of residential programs. For the programs that are up and running, there are sometimes quarantine requirements that require someone to sit somewhere for a period of 2 weeks. So we have to figure out what housing looks like, and keep someone, keep their buy-in. Keeping track of people by itself has been difficult because folks losing jobs or housing or facing other hardships related to COVID-19 can be difficult to catch up with and can be moving around quite a bit. So these are all challenges that we've been trying to meet. One unexpected outcome, since we've been doing all of our work just as we're meeting right now on Zoom, the court uses a different competitor platform. But one of the unexpected results is that we're actually still able to create community, something we miss from the in-person dialogue that occurs when people come to court. But we're able to recreate that to some extent online. Most of our people are actually appearing. We've been able to plug into some of our different programs, especially residential programs. I get to talk to people from the comfort of their own homes and couches, and folks are more relaxed. When you come to court, oftentimes that alone is a very stressful situation and can be a trigger for relapse. And so we've seen some successes in those areas. We work with people across the board. So even though we're focused on whatever the initial assessment identifies as some issues that are going to be important to keep people away from the criminal justice system in the future, and usually those are substance use and mental health issues, we are working on the whole person, and consequently we've tried to extend our tentacles and networks of support into the community to be able to address the housing issues, the food instability, employability, and we have frequent court appearances as well, but that's more of a measure of keeping people on task and keeping them accountable. Again, we don't want people going to jail, but we do need a constant check-in to make sure folks are with us in this, we have their buy-in, and to make sure that we can be responsive to the immediate needs that they might be facing, obstacles that might even prevent them from performing in the work that we're asking them to do, which is all about them and all about lifting them up to help them meet their potential. Some of the other barriers we've had that we've been successful in overcoming include testing. During the pandemic, we've been able to extend testing for drugs across the county. And I know some of you are thinking, well, Smiley, you're still testing folks during the pandemic? That's actually an evidence-based practice that's really necessary. It's a big part of recovery. And we don't use it in a way to say, you know what, you tested dirty and now you're in trouble. That's not the way we operate. In fact, we need people to know, and I'm constantly messaging the idea that if you test dirty, that's the time you want to come to court. You'll never be remanded for testing dirty. It just gives us an opportunity to have some discussion and figure out better supports for you. And if we can't provide it, we can certainly find the people who can. In fact, many of the people you've been hearing from today are the type of people that I'm excited that I'll get the opportunity to work with in the future, because I'll be making some phone calls after this. And the speaker after me is just a terrific asset to Alameda County and the work that we do. We have, of course, had to deal with the loss of personal contact from the shelter in place and social distancing rules. That's we thought would be the biggest obstacle, because you know, when people come to court, it's a different experience altogether. I wear my robe, but I don't sit on the bench. I sit at the table with the program participant, and the program participant is seated next to his or her lawyer, but next to that person is the prosecutor. And then we have the treatment providers sitting at the same table with us. We're all on the equal plane. We all have an equal voice. As the judge, I'm usually the referee. So if there's a disagreement about how to best serve somebody, thank you, I might make the ultimate decision. But we lack that when we have a virtual court. And so we try to recreate that to the best of our ability. I want to end by just sharing with you just a little bit of information about our collaborative courts in this last slide. Coming up just a second. First, this one here goes over some of the information I just told you, but it's important for you to know that our participants usually stay for about 12 to 18 months total. Sometimes it's shorter if the time on their PRCS runs, and we try to connect people with services that will survive their the supervision that we've been put in charge of if they're referred to us. The last slide, and what I want to end on, is this one here concerning our collaborative court offerings. We do have a reentry court that I've been talking about today. We're very proud of it. We put a lot of thought and energy into it, and it has its successes. It will always have its challenges, because we deal with the high-risk, high-needs population of great, interesting people who have a lot to contribute. But we also have other offerings from the court. And so it's important for me to let any community that I speak to know, since I'm the supervisor of collaborative courts, that what you're looking at is a screen of all the different specialty courts that we've been able to create, where we're not interested in people being a part of any system of cages. We're interested in people receiving treatment, improving their lives, and contributing to the greater community in the way that we know they want to and that we know they're capable of. And so, just because someone's not eligible for reentry court, might be eligible for one of our other courts. And I appreciate everyone's attention, and I wish you good health in these historic times.
Let's give a clap and a thumbs up for Judge Smiley and that very informative presentation. And our last speaker now will be Donald Frazier from Building Opportunities for Self-Sufficiency, better known as BOSS. Take it away, Donald. Oops. Little technical difficulty.
Good morning, everybody. Give me 1 second to get the everything up on the screen here. Be patient with me.
Yeah. Oh, yeah.
All right. Yeah. Okay. I think I figured this one out. I guess I should have had BARHII handle this one for me. We'll get it. Okay. Is it up on the screen?
Yes.
Okay. Let me.
Okay.
Hold on 1 second.
If I can.
To share it, I have it up.
Oh, you have it
up? Yeah.
Yeah.
All right.
All right, brilliant. So you.
Just give me 1 second.
All right, while you're getting that together, and appreciate everybody's patience with me. So my name is Donald Frazier, and I want to just thank BARHII out of the gate, and of course Kim Carter, Dante Blue, Chloe Noonan, and of course, Judge Smiley as other panelists to move this process forward. As Darius mentioned, you know, my upbringing in Chicago, where I connected with the revolutionary idea that the power is and has always been with the people, and that the people closest to the problem have the solutions to those problems. And the need for distributive justice in the allocation and reinvestment in communities that have been historically and currently under attack by systemic policy violence is necessary. I'll be presenting on the intersection of COVID-19 with incarceration and reentry. Next slide, please. So the points I'll be discussing are today is our work here at BOSS, a quick overview of a multi-state trial on COVID-19, incarceration and reentry, findings and snapshots of data. And I will close with statements on how we can seize the opportunity to transform the criminal justice system here in California. Next slide, please. I put my website, the BOSS website, my email address and phone number in the chat box for folks if you want to contact us. Next slide, please. You want to roll to the next slide? Folks on the BARHII side. So again, I'm the executive director of Building Opportunities for Self-Sufficiency. And BOSS has 13 sites located in Alameda County, serving the cities of Berkeley, Oakland, Hayward, and San Leandro. And we develop solutions to mass homelessness, mass incarceration, and community violence. And we're dedicated to the inclusion of people. I guess the screen got lost again. But we're dedicated to the inclusion of people marginalized by addiction, trauma, criminality, incarceration, poverty, racism, sexism, homelessness, and violence, with reentry and neighborhood safety, housing, and social justice programs and services delivered to the people. So at the onset, I'm going to get this together.
No problem.
Trust and believe.
Let me see if Siobhan.
Okay. As I mentioned about BOSS and what we do, and at the onset of this novel coronavirus pandemic, we've been working closely with CDCR, OES, with the Office of Emergency Services in Sacramento, BSCC, California for Safety and Justice, and the Governor's Office, and providers across the state to assist and help organize releases to the community and connections to needed resources. I want to go into the conversation around COVID, the intersection of COVID and reentry and incarceration. And so in 2020, the Prison Policy Initiative cited that the American criminal justice system holds about 2.3 million people in 1,833 state prisons, 110 federal prisons, 1,772 juvenile correctional facilities, 3,134 local jails, 218 immigration detention facilities, and 80 Indian country jails, as well as in military prisons, civil commitment centers, state psychiatric hospitals, and prisons in the US territories. A lot of incarceration happening in the United States. The Institute for Justice Research and Development, IJRD, published early findings on the experiences of the COVID-19 virus and the restrictions enacted to control the spread of the virus among those who were incarcerated.
CO330, that's never a good thing, especially it coming from that direction when traffic
Can I
starts
have
getting
you-
thick.
Tim, you need to mute your phone.
Mute your phone. Thank you.
So as I said, the Institute for Justice and Research and Development published early findings on the experiences of the COVID-19 virus and the restrictions enacted to control the spread of the virus. among those who were incarcerated and released between April 14th and August 19th in 2020. And the authors, Dr. Carrie Pettis Davis, Stephanie Kennedy, and Faye Miller, authored this particular study. And what was found was more than 110,000 individuals incarcerated in federal or state prisons have contracted COVID-19. And of that number, 908 have died from the virus. Nearly 24,000 prison correctional staff contracted the virus. And of that number, 57 died from the virus. And based on these statistics, individuals incarcerated in prisons are 246% more likely to die from COVID-19 than a correctional staff that are there. And there have been recommendations to control the spread of the virus, include mass releases to quickly reduce the facility population without jeopardizing public safety. And I want to get a little bit into that really as I close out with decarceration efforts that are extremely important. The snapshots of the post-release cohort of the study. And so they had a cohort of 177 participants incarcerated during COVID-19. 8% tested positive for COVID-19, 23% said that while they were incarcerated, other incarcerated individuals died from COVID-19. 89% said that they felt safer in the community than prison. 70% of facilities, as the COVID-19 spread across the nation, 70% of facilities suspended isolation, visitation from loved ones. 70% of facilities suspended volunteers from coming in. 64% of facilities suspended professional visits. 62% of participants were offered free phone calls or email access to the people on their visitors list. And 57% of facilities suspended programming. 5% of participants were released ahead of their scheduled release date. A little bit more on this. Say, in terms of how participants learned about COVID-19, 54% learned from TV, 26% by official announcements from correctional staff, 20% through written materials supplied by the correctional facility, 16% from other incarcerated individuals, 16% through informal discussions with correctional staff. And then some of the facility strategies to prevent exposure are listed there as well. And then participant strategies to prevent COVID-19 exposure are listed here as well. And it's the traditional, or what has become traditional, hand washing, face coverings, and physical distancing. I want to kind of get to this and spend most of the time in this presentation around how do we seize the opportunity to decarcerate the state of California. And so, you know, COVID-19 really presented an opportunity as traumatic as it was. And it kind of uncovered certainly a lot of racial disparity and beyond the racial tension, just the disparity in healthcare, the disparity in education, the disparity in the criminal justice system, the disparity in employment, across the board, land use, transportation, all of these policies, and it's really around issues around policy, were exposed as a result of COVID-19. And I think if we need to at least look at and consider this as an opportunity to move, to create movement on righting some of the wrongs that have been done. And so we understand the reason why COVID-19 spread like wildfire in the prisons, because the prisons are overcrowded, right? It's not rocket science to just on that basic observation. And I'll say 122,000 people in California prisons cost $11 billion to keep them incarcerated. And so Governor Newsom's recent actions to stop the spread of COVID-19 with the releases was a good one, right? It was a good move. But I think what happens next could be the definitive answer between temporary relief for thousands and permanent relief for millions. And I think we need to consider expansion and permanent incarceration reductions, right? So how do we reduce the number of people who are incarcerated? Whether it's these low-level drug crimes, shoplifting. I mean, there are a lot of people who are incarcerated on some very minor charges. The idea around expanding reentry assistance to support safe releases and stability, and reallocate the savings back into local communities for programs proven to prevent crime from occurring in the first place. We should look at reducing sentences, expanding eligibility for immediate release, including the elderly, folks with underlying health conditions, or who are at low risk for recidivism. We even need to consider closing a prison or two and save $300 million with one closure. I know Governor Newsom has in his budget the closure of actually 2 prisons that he's proposing. That would be a good deal. And then reallocating those funds to provide block grants for communities struggling with crime and require local health and safety systems to plan together and share data and to scale up crisis assistance. A couple of more, just to decriminalize certain activities and reclassify certain low-level felonies. Expanding use of alternatives to prisons for non-violent crimes, and divert people with mental health and substance use issues away from the criminal justice system altogether as a health issue, public health issue. Reduce the length of prison terms and parole and probation periods, and restrict the use of prisons for technical violations of parole or probation. I want to end by saying, BOSS partnered with LARP. That's the Los Angeles Regional Reentry Partnership in Los Angeles, to form, in partnership with Californians for Safety and Justice, to form a California Reentry Provider Association. So we're in the process of building this, and we have about 25 providers statewide so far. And I think one of the, it's through the Bay Area, Central Valley, Southern, and the coastal counties in California. And I just want to say, if you are a reentry provider and want to be active, an active participant in transforming this criminal justice system landscape, my email address and phone number is in the chat box. And I strongly urge you to come with us and get with us, because this is the opportunity and the possibility is now. And I ask you to, one more time, just to join the struggle, to organize for revolutionary social change. With structured self-determination in communities of color, primarily Black and brown communities, alongside white communities, responsibility for ending white supremacy. And ending, I'll just say yes on 17, no on 20, and thank you for your time.
Well, thank you very much. And we thank all of our panelists for that great conversation today. And so, because we're running a little short on time, we're gonna present a couple of questions to the panelists, and let's just see if you all can answer them, and maybe 1 minute or less. And then if someone in the audience might have a question, you might want to just chat it in the chat box, and I'll do my best to get it to one of the panelists. So I think the first question would be, since we already ended on Donald's note, we know that the summer uprisings that sprang up after the killing of George Floyd ushered in calls to defund police departments. Side by side with that call, communities are calling for divestment in prisons and investing in things that improve the lives of those who community safety. How do you see the divestment conversation intersecting with today's conversation about reentry? And I'll put this I'll give one of our panelists, whoever wants to answer that first. Let's go with Judge Smiley, since you talked about the collaborative courts.
Let me ask you to rephrase the question, counsel.
So the question would be, how do you see the divestment conversation, the divestment in prison systems, the conversation intersecting with today's conversation about reentry?
Well, from my perspective, and I'm here in the capacity, I should point out, just talking about reentry court.
We know that telehealth, that's another key point.
I'm not talking for the court system, for any court system, and I'm very protective of the participants that I have. So in advancing the cause of treatment, I am anxious to see how we might better resource treatment as a part of the system overall, instead of treatment courts being a small exotic piece of what happens when people are system involved. I'd like to see that become a much bigger part of the work that we do as the system as a whole. That would be my unsatisfying answer to that question.
And one of our other panelists would like to take a stab at that. Okay. Then the next question I want to put forth, and we didn't really talk about this much, but recently, you know, Governor Gavin Newsom launched a 30 million public private partnership with philanthropy and nonprofits to provide reentry services for the men and women who are being released from prison as a result of COVID-19. My question is, what can we learn from examples like this to improve the reentry process over the long term? How about you, Chloe? Would you take a stab at this one?
Sure. Thanks, Saris. I mean, I think it maps out a great example of how public and private partnership in the state in order to financially invest in solving social issues is possible and can be achieved. And I think that part of, you know, building on the gains of that partnership for the short and long term will really be holding legislators accountable to continuing to invest in community-based organizations. You know, I think of, you know, really, I think it can help bolster future messaging in terms of community-based organizations that are, you know, not connected to corrections, that are working directly with impacted people, that are embedded in the community and know what supports people need, that there really needs to be direct financial investment in those programs, and that people who are closest to the problem are closest to the solution. The statement that was made earlier, really these are the organizations that are best situated to help people navigate reentry and you know, rejoin their communities after incarceration. So those are a couple thoughts I have.
And how about you, Kim? What do you feel about that?
Well, you know, I go back to the public health framework. You know, we need to look at the ecosystem. I believe strongly in prevention and intervention. Now, while we're talking about mass incarceration in adults, you know, we haven't even looked at the twin, which is a child welfare system that basically mass incarcerated our kids, right? So when we're removed from the community, you know, our kids are at risk for this child welfare system that basically, you know, takes blacks and brown bodies and creates these industries off of them. So no system wants to see a shift of power or money from it to the community. Like we're fighting against systemic oppression that's controlling resources. So it's all about demand, you know, it's all about, you know, resisting. We can't conform to a governmental structure that basically does not support, you know, the uplifting of black and brown people in the community. So we have to look at this from, you know, this pandemic perspective, which is the COVID-19, which basically just exacerbated and demonstrated what was already there. There's already reports out, random reports and other reports out that show disparities. You know, black and brown people, we're not that unlucky. We can't be in the bottom of every category of everything all the time. Like, no, there has to be, you know, some way to really look at this systemic racism and come to a agreement where we're gonna say we're not gonna tolerate it no more. And with that comes allocating resources into communities and into black and brown organizations.
Thank you. Thank you. And I guess, so since we're short on time and I want to be respectful for everybody's time, the question is, this is from Jeffrey Lynn, and asking the question, what is the best role for healthcare workers providers in the ecosystem, either within the correctional system or in the outpatient setting. Anyone, you all would like to answer, take a stab at that question? Donald or Dante?
I'm not sure what the basis of the question is, right? In terms of, folks in the healthcare system, is it related to COVID? Is it related to just the generality? I'm not sure.
The basis of the question is just talking about this ecosystem, either within the correctional system or in the outpatient setting. So what is the best role for healthcare workers? I guess pertaining to furthering the cause.
I would add for reentry.
Oh, for reentry. Okay.
Somebody else could take that one. I'm not
okay.
A healthcare expert at all.
I would like to take that one. I would like to say, my heart goes out right now to healthcare workers because, this pandemic also demonstrated that healthcare workers, are essential workers. And when we look at, the plight of the healthcare worker with access to some basic necessities like housing, in these communities, they're often left to the side and discarded. This is like people coming home from incarceration. So I wanted to give my hat out to the healthcare workers, number one. And number two, I would say stay safe, and keep your nose to the ground that change is coming. Change is coming. Let's get in that good trouble. If you're at that meeting and they're talking about conforming to the way things was, hey, you guys, you recall it, we are dealing with systemic racism, and we did declare the public health crisis. What does that actually mean? Start pushing them back on some of them resolutions they done passed and stuff and bringing that up. Let's get in some good trouble.
Well, thank you. So with that, we are at time, and I do wish we would have had more time to go deeper into this conversation. But on behalf of BARHII and Rise Together, I do thank all of our panelists for providing us with a wealth of knowledge that will help us to continue to advance opportunities in health equity and economic well-being to the many individuals of color who are returning to our communities from incarceration through our Fair Chance work. And I also like to thank the audience for attending. And also, I'm sorry I didn't get to everybody's questions, but thank you for the thoughtful questions that you have put up. I would like to, if you all, anybody out there would like to partner with BARHII and Rise Together in helping to implement the recommendations to improve systemic barriers to employment for individuals with a criminal record, while increasing availability and accessibility of proven workforce development and employment opportunities, those things that were fostered in Rise Together's opportunity for every worker report, then you can please contact me for that, and I will put my email contact up in the chat box right now. And because we want to keep this conversation, we want to keep these things going, and community and people that come together, we're in at a time where people are looking for change and they want to see change. And now that we're here, let's not let this opportunity go to waste. Let's all work together to create that type of society that we know that we could have, that exists with fair and equitable housing, employment, and all the essential things that gives everybody an opportunity to live a first-class life. Thank you for joining us, and we hope to see you again.